everyone, Dr. Rob here, and today I'm going to be focusing on a case I'd worked on recently where we have almost directly combined physical therapy and microcurrent therapy together. So this patient was named Ron. We're just going to go with first name. It's pretty, protected that way. He was 48 years old. He works as a carpenter. And so he had a fairly active lifestyle. There's a lot of heavy lifting, some overhead motions, right? They're required for work. And he likes to play tennis, which also more overhead motion as well. So Ron reported persistent shoulder pain as well as weakness in his right arm. And this was particularly during overhead activities and also lifting objects. So the pain had gradually worsened over 3 months following an incident where he said he felt like a sharp pain while carrying a heavy toolbox. Now, Ron had no previous shoulder injuries, so I knew that there was likely no scar tissue involved in this process. He was considered in general to be in good health with no significant comorbidity, so he never really mentioned anything else that was a problem prior to this. Now, he actually went to his doctor first, and they did a physical examination, and he said that what he complained about was painful and limited range of motion in the right shoulder, weakness during rotation and abduction, and positive results for impingement tests. So essentially, they ended up doing an MRI, and they confirmed he had a partial thickness tear of the supraspinatus tendon and a component of the rotator cuff, so a rotator cuff injury. Given the severity of the tear and the fact that he had a fairly active lifestyle, he was put on a fairly conservative treatment plan by his medical doctor. Now, first and foremost, this involved rest and activity modification. So Ron was advised to avoid heavy lifting and overhead activities. So this is kind of one of the things we do. It's a bit of a catch-22 because on the one hand, it's good that he's resting. On the other hand, it means he's not using it. So he's going to potentially cause more issues, which is why number 2 was a physical therapy program, a program focusing on strengthening the rotator cuff muscles, improving stability of his shoulder, and enhancing his range of motion. Both things so far, kind of good. Next, he was told he should be on anti-inflammatory medications. So just NSAIDs. These were actually prescribed NSAIDs. They were a bit stronger than what you buy on over-the-counter. And this was to manage his inflammation and pain. And he was offered a corticosteroid injection, but the doctor, thank goodness, was pretty conservative about this and said this is reserved as an option for if pain persists despite what we're doing already. Now, this was when Ron came to me. He'd been taking these NSAIDs for a week, and he was getting a very upset stomach, and he was complaining about it on Facebook in his family Facebook group. I didn't know people did that, but it seems kind of cool. He really didn't want the injection, and he was just complaining about this pain. His cousin had suggested microcurrent therapy by commenting on his post, and Ron happened to live very, very close to me. So it's funny how these things just end up working out. Now, the physical therapy was helping, but Ron felt like he wasn't getting enough of it. And this is where I hoped we could step in. It was going to be kind of like a bonus physical therapy session. So I immediately wanted to initiate the physical therapy programs through the Pinnacle using the eSTIM programs. Now, these are designed to mimic the types of devices that a physiotherapist will likely already use. So I started with eSTIM T1, as you do, and the goal was to move up from there. So what I always try to do is isolate the injured area and use that conductive pads, typically 4 pads, to surround the injured area. And then when you've gridded off the area, you can then run the program, really for as long as the person can tolerate. For me, this was only about 5 minutes. This was the point when Ron said, hey, this is starting to get sore, and so I backed off. I actually then pulled out PEMF. I used my trusty Sana Chi, switched to Via Chi mode, and I used Sana Soft T to try and regenerate the tissue. And also, as with all energy medicine, we're enhancing circulation. So this passively brought in more blood flow to the area. So we were lucky that treatment had started fairly early on in the injury cycle, because aside from mild soreness, Ron was doing okay with the therapy. Now, my plan was to see Ron again later that week, but I felt like the strongest option for him was going to be to work on a more regenerative and circulatory treatment plan, especially since his physiotherapy plan had him restricting his movement and resting. So considering the injury, I thought it was a good thing that he was not doing his daily activities, but I wanted to be able to facilitate and enhance that. So in order to pull that off, I sent him home with a Genesis and a Chi-Wave PEMF pad. I told him simply to run blue stimulation for 15 minutes, 2 to 3 times a day over the shoulder. I showed him how to use it. Maximum power, super, super easy. Now, after a week during his next session, Ron reported significant improvement in pain and shoulder function. I encouraged him not to push it, although, based on my conversations with him, I'm sure that he did. But during our next session, I noticed he had regained approximately 50% of his pre-injury strength and mobility since that previous session. So I knew we had a winning treatment, and it's kind of one of those why fix what's working so well. So I ran the physio program eSTIM T1 again. This time I made it for 15 minutes. Remember, you normally try and get to that consistent 20 before you move up in the eSTIM tiers. Then I used my Sanity again on that soft T. It was going to work, so I was using it. I encouraged him to continue to treat at home. We repeated the treatment weekly with improvement every time. Now, it's important to note that he continued physio during this time, and by the end of 4 weeks, he had gained nearly 90% of his pre-injury strength, and he was cleared to go back to work in about half the time that he expected. So what did the trick? I think it's all about the combination. A lot of these videos I've been doing here focus on that idea of combining therapies. The physical exercise, both from the microcurrent and the physiotherapy itself, allowed him to rebuild the tissue. But this was enhanced with the improvement of circulation, our anti-inflammatory, the tissue repair signals from our tools and from the treatments he was doing at home. Now, Ron was absolutely convinced that the treatments we did were the deciding factor of him recovering or not. I don't know if I necessarily agree with that. I think it played a huge role. The purpose of this short case study was to showcase exactly this, though, right? Multifaceted approaches to therapy will almost always win out over those that hyper-focus on one specific therapy. Now, luckily with microcurrent, we can do PEMF, we can do scalar, we can do light, we can bend the rules and have more than one tool within one tool. So as much as Ron credits the energy medicine tools, I believe that the physiotherapy itself played a huge role in his recovery too. I wish we could work more in tandem with other practitioners more often to amplify these results more frequently. Really, these devices need to be in these physio clinics and part of the treatment plan for everyone. Anyway, I hope you found this useful and or interesting. A reminder that our Black Friday sale is currently running between now and Monday, December 2nd, 2024. You can save up to 40% on our equipment and other products at thesanashop.com. Things like a Pinnacle and getting a free VHE. This is something that does not happen very often, so huge savings to be had there. Otherwise, everyone, take care. Thank you for joining me and have a wonderful weekend. Bye-bye.